Physiotherapy is an important component of orthopedic treatment. In fact, it is often one of the first steps in addressing an injury. The primary goal of physical therapy is restored function and a return to activity. But these things are often a byproduct of the larger rehabilitation process. Physical therapists blend their knowledge about surgical procedures and rehabilitation and provide customized care thereafter. There are only 5,000 qualified physiotherapists in India, whereas, according to the World Health Organization, there should be one for every 10,000 citizens. Consequently, according to WHO norms, there is a shortage of 95,000 physiotherapists in India. World Physiotherapy Day was started on September 8 in 1996. The day marks the solidarity of the global physiotherapy community. We at Medicircle are conducting World Physiotherapy Day awareness series in order to raise awareness about the importance of physiotherapy and the role physiotherapists play in keeping people fit and well. Hello, I'm Aprajita Mehra, and today our guest for the talk is Dr. R. Harish Kumar. Dr. R. Harish Kumar is a physiotherapist at his own clinic named Sai Healthcare Foundation since 2008 at Mylapore, Chennai. He treats patients of orthopedic, neurology, sports injuries, cardiac rehabilitation, post fracture management, post cancer management, post surgical management, ergonomic corrections, posture corrections, and more. He conducts free physiotherapy awareness camp at frequent intervals to bring awareness to the public and in the society. He has also published his first book on physiotherapy in Tamil named Valli Galai Vellalam, and this is the second Tamil book in physiotherapy for the general public. He was also awarded with Dr. APJ Abdul Kalam Award for the year 2016 by Coimbatore Physiotherapy Doctors Association for his work towards kids and students' welfare through his Kids Arogya program. It is such a privilege and honor for us to have you today at Medicircle, sir. We really welcome you with a lot of affection and gratitude. So welcome, sir. And how are you today?
Thank you. It's my pleasure to be a part of it. I really appreciate this initiative. I'll give my best.
Thank you, sir. Thank you so much. So, Dr. Harish, my first question to you would be, what are the different techniques used by physiotherapists? Just elaborate on this.
Yeah, this is a nice question because many of the public will have a doubt what is physiotherapy, what are the techniques they are using it. This is a big question for every a general public from a point of view. Physiotherapy is a medical science where we use electrotherapy modalities to reduce the pain and discomfort, and we doesn't use any form of drugs. That is, any type of pharmaceutical medicines is not prescribed or it is not given by these physiotherapists. So physiotherapists use exercise therapy or electrotherapy modalities to heal the condition, to treat the condition, and to recover the patient. So we use forms of heat therapy or micro vibration therapy or a form of distraction therapy. All those things are the different techniques. So we have basic physiotherapy and advanced physiotherapy. In that we speculated and we give a treatment to it. We have light therapy also. Laser therapy comes under that, and we get treatment in this. The main advantage of physiotherapy is it doesn't give any side effects. It doesn't give any counter reactions. Many people have a myth that there is some, if I take physiotherapy, counter reaction and all those stuffs and all. Not such. Because once you take the treatment, your body is starting to bringing back to its normal process. That is our main idea. The main concept of physiotherapy, whatever technique we are using it, the main concept is to bring your body's regular process back to the normal thing. So when it comes back to the normal thing, there will be some turbulences taking place in the body. So that is what is happening. But much of the people will have thought that it is a disturbance. It is a side effect of the treatment. It is not the side effect. It is the turbulence of it. And it is a normal process. It is not an abnormal. Your pain is only an abnormal. We treat that pain to bring it back to normal with all these techniques. So there are
Right.
many hand techniques are there. The
Mm-hmm.
recent advancement is there's a technique called we are treatment at the cell level, treating the cell biology. Normally we treat the muscles, but here we treat the cells also. So it is one of the most upcoming and most advanced profession in medical industry. So
That is
physiotherapy,
absolutely unbelievable. Treating it at cell level is like
yes.
really amazing.
Yeah, I am specialized in that treatment. I did my special training in Germany with the scientist. So my specialty is on treating on cells level. So normal physiotherapy treat on pain management alone. But with this, we can treat a open wound, systemic management like migraine, sinusitis. All those stuffs can be treated. It is a after that. It is a big boon. That's what I'm saying. In another 10 years to 15 years, physiotherapy industry is going to rule the medical science. So it is going to change. It's the future is ours.
As it is, this pandemic has absolutely shattered all our dispelled all our thoughts, whatever we had regarding how to keep ourselves healthy. It has already dispelled a lot of myths that we have finally people are actually going back to being fit, taking care of their
Yes,
diet, and going by a good
correct.
lifestyle rather than just trying to support themselves with healthcare, though these changes are
Physiotherapy,
actually quite visible now.
physiotherapy played a vital role in post-COVID and COVID cases, and prevention also. This played a vital role. We have trained the lung performance of the patient, and that will improve your lung if it is infected. So preventive treatment management post-COVID, physiotherapy played a vital role in COVID treatments and all. So it is a vital. It has been a place where we can show our expertise. Yes, these physiotherapists can play the game here. So that is how everyone's focus started to lay on us. WHO started to recognize us in a different level on putting the posture training and all. We physiotherapists did this posture for years together, but COVID has given a limelight for us, and it has changed the scenario how it is.
And I'm sure it is for betterment of everyone, including doctors and patients alike.
100%. It's a
So,
time. It's a time. It's 100%. It is
and this is more holistic way of healing yourself. When we treat
correct.
ourselves
Correct.
with these kind of treatment that that techniques that you're telling, they are more holistic
Yes.
and more in tandem with our natural body rhythm and our body, rather than taking medicines and trying to somehow cure it later. So more preventive.
That's what. That's what it is. It is a form of a medicine. Physiotherapy is a form of a medicine. See, allopathy it's a form of a medicine. Siddha is a form of medicine. All are medicine practice only. But whether we give drugs or not, there are two forms we say: medicine practice and drug practice. Homeopathy, allopathy, all those comes in medicine practice.
Right.
Drugs means we depend on drugs or not. Physiotherapy is a profession where we reduce the drugs and we put down the drug volume for the patient.
So now that you have mentioned so many pathies, my next question to you would be, what is the difference between physiotherapy and osteopathy? So could you
Yeah,
just,
perfect.
clear this biggest doubt on people's mind?
Yeah, perfect question. Physiotherapy is a form of medicine, like which we treat with electrotherapy modalities like heat and vibration and other formats, and we use exercise therapy to recover the patient's comfort and bringing back the process of the patient. So this is physiotherapy. What is osteopathy is it is also a form of a alternative medicine therapy where we use a massage or hands-on technique to treat the condition, particularly the visceral organs like the stomach, liver, kidney, all those stuff. It has been done through hand. It's also an hands-on technique. It's also an hands-on technique where it treats the condition with the reaching the visceral organs,
Okay.
particularly the that is the
Mhm.
difference between physiotherapy and osteopath. So osteopath or osteopathy we say. In there is one more called as chiropractic.
I was
Chiropractic.
just, the word was just about to come out of my mouth. You just explained the chiropractors also right now, because that is also a new in vogue word that we are hearing
Yeah.
everywhere.
This three people stand in same line but have a difference of only one line. That's it. Chiropractic is a practitioner who works mainly on the joints on a thrust basis of treatment. So he does a certain high volume thrust on the joint to create an impact to open up the joint. That is the
Okay.
chiropractic. For example, if they do it for the neck, they are opening particular C4 and C5 level of facet joint, they are opening up. They should not do it repeatedly many times. If they do it once, they should get the click sound. If they're not getting it, they are not allowed to do it repeatedly. That will have a micro damage to the tissues.
All
So not
right.
chiropractic. Not
Yeah,
everyone can
because
become.
in old wives' tales, we've always been hearing from our grannies and everyone that we shouldn't be doing this. This
Yes.
cracking of bones, and everywhere the
Yes.
kids have this habit of
Yes.
just doing this, cracking their
Ah.
fingers all the time, clicking their fingers. So it is normally was always advised not to do it. And now that the
Yes.
chiropractors are in fashion, the kids are like, okay, they just break all the joints open, and it is like very helpful.
No, once it's a professional chiropractic means they will know how to handle it, how much to the thrust has to be given. There are
Mm-hmm.
graded thrust, 4 graded thrust. They know how to give it. But when it comes to a layman, you go to a barber saloon also, they do this technique, taking click sounds and all. That is not at all advisable. That is what I'm trying to say. See, my point of giving awareness is where we have to do it, whom to approach and whom not to approach. Chiropractic is a good technique.
Absolutely.
Every profession, every form of medicine has its own limitations. We have to accept that limitation and we have to stand within that boundaries. Chiropractic has certain limitations. Osteopath has certain limitations. We cannot. Physiotherapy has certain limitations. We cannot say that every treatment I will do it. If it's a first aid, if it's a heart attack, play a role there. I'm going to just give a first aid for them. If a fracture patient comes to me, I can do only a first aid. I cannot do a surgeon. I'm not a
So
surgeon.
true. So true.
To do a surgery. I will do a first aid management and I'll advise the patient and I'll train the patient that you have to be educate the patient that you have to do surgery. You have to do the right form of therapy. Don't go into the traditional form of the putur cut or something like that. Don't go into that. Go into the regular form of medicine. Get treated well. Come after the surgery or the rehabilitation. This is the part, my place. This is the boundary how I have to play. I should not say, come, I will do all those procedures. I will do suture. That is not my way. That is how we have to be approachable in the society. Then automatically the profession will come up.
Right. So my next question to you, sir, is quite off the contrary to what listeners would be expecting. I would like to know that what a therapist should take care of while giving service to patients. Is there anything that, as a general guidelines, you people follow while giving a good service to a patient?
100%. That's what I said. Our boundaries. How a cricket players play within the boundaries. Also, or any healthcare professional has to play within their boundaries. So we have certain guidelines. Say, for example, a patient comes to me, right? Once a patient comes to me, I will take a database of the patient who is coming inside, who is taking treatment, starting from his address, his locality, his contact number, his mail ID. All those things has to be done in the front desk people. Once it is done, they are coming through reference or through a direct patient, because some doctors might refer to us or direct patient can be. Once they come inside to the assessment part, they come into the see me or a consultation, we do an assessment. In that assessment, we do a proper history taking of the patient. Why this pain has come, how this pain has come, what all the pros and cons, why it has aggravated, what is the aggravating factor, reducing factor, how many days he is having a duration of the injury. All those steps we take. What are the investigations they have done? They have done any MRI or any X-rays it is done, or no, nothing is done, means what can the advice can be, investigation we can give it. So that we need to, once the patient say it is a clinically, this is the complaint I'm having it, I'm going to get treated for these thing. I should be strong with the clinical establishment and the investigation process. Like the X-ray or document, we have to document it. Yes, if it is a disc prolapse, yes, disc prolapse is proved clinically with the clinical test as well as with the investigation like X-ray and MRI. For that, we do certain clinical tests in the clinic. We have certain tests. We do it for the every condition from head to toe. We treat it. For example, for giddiness, if a patient is coming, we can find it out whether it is an ENT problem or because of the musculoskeletal issue. There is a special test for it. Once we do the test, you can easily differentiate A or B. So if it is A, it is our practice means we will say yes, you can take physiotherapy. This is the treatment you have to take it. You will be fine. But if it has become B, it says that it is not in my scope of practice. I'll say no, it is an ENT complaint. Go on, please check an ENT. If ENT says that yes, it's my food, I will start taking treatment and he will do the relief for the patient. Same way for every condition, every segment we have it. So we have to differentiate these things, and whether we are coming under these criteria, we have to decide it. Once after deciding all these things, we have to explain to the patient, this is the problem, this is the reason I'm going to give this treatment, I'm going to put you on this electrotherapy treatment, I'm going to put you on this form of treatment. This form of treatment is given to reduce this segment, muscle or nerve inflammatory reaction. I have to explain the patient, because treat the patient, he should be aware about the what the process I'm going to do it. So once you have to explain the patient, educate the patient, then we will shift them to the treatment area. Then they will, once the education process is done to the patient, he will be the master, not me. He will be the master, what to be done. He will be sincerely taking it. He will understand the process, how the exercise is going to be advised. He will understand how his body is responding to the treatment, whether it is on the positive side, negative side. He will come on, express the needs to us. So these are the specific guidelines what we follow before starting a treatment. Anyone can give a treatment, but fixing the condition and giving a boundary to it, yes, this is our game. This is the way I'm going to play the game. This patient is my cup of tea. I'm going to take it. Yes, guideline starts with an assessment. That's why we do an individual assessment for the patient. If we get a request letter that please do physiotherapy, so on so technique, we never do it. Because they are orthopedic surgeons, they are surgeons. They can refer to the physiotherapist, but they cannot prescribe a treatment that is not ever given anywhere. We have studied 5 years for this course.
Absolutely.
When we get a surgical patient, do I say, I refer a patient, sir, I have a surgical, so on so patient has a surgical. Do I give, say, sir, put this plate, this screw, this level of suture? Do I say anything? That is his play of area. They should understand this is the professional boundary, professional respect, what everyone expects from every profession. So that is how it has to be. So this is the main boundary what we expect from every profession.
So now that you have advised how therapists should be, taking their patients and, taking cases only according to their domain and what can be actually treated by them, I would give the same advice to our audience also. While the physiotherapists have such fantastic guidelines to abide by, you should also always take care that you need to go and see a specialist where it is required, and do not. Yeah, please, sir.
I have one more point. There are so much of myths running behind. That is where this complication comes. This problem comes. There's a question whether we can go and see the physiotherapist directly or not. Yes, you can see. He's like also a medical practitioner. We also give a boundary for us. We have a boundary for us. A patient comes with a cut open wound. We cannot do anything. We cannot do a suture. We are not allowed to do a single puncture on the skin.
Right.
So this is a patient has to be aware. You have to come and ask the patient. If we say a patient therapist is charging a consultation fees, yes, it is your right to ask the question. You have the right. That is why you are paying a consultation fee. Why you are not asking patient to us? If the treatment is not good, you are not getting result, you have to ask, doctor, why my pain is not responding? Do we need to do any further investigation? The doctor will do immediate reassessment. He will recheck what has happened, why it is not responding. For that only we are studying these much years. So public has to be aware. I request the audience, don't hesitate to meet a physiotherapist. You can straight away go to a physiotherapist, get the treatment done, get your doubts. Don't Google it. Please don't do Google it. Don't see the Google. You come to the regular doctors who have studied professionally. After training only they get certificates, all those things. You check the credibility of the doctor, like a certificate, whether it's a true doctor, whether he's a regularly a or not. There might be quacks in every areas. I cannot say that it's a public's interest to find the quacks. Avoid the quacks. Go to the good professional physiotherapist. You will get a magical result. Every healthcare professional is magical. Whether you are in the right hands or not is the big point.
Wow, on that amazing and most informative note, I think we should end this interview, because whatever already you have informed us is with so much vital information that we need time to assess this, and be careful and cautious next time visiting a specialist. I'm sure all the audience must have gained something from this. So thank you so much for coming to our show and sharing your valuable time and insights with us here at Medicircle. It was really
my pleasure. It's my pleasure sharing my knowledge. It's short, but it's sweet. It gives a crispy effect. I thank Medicircle for inviting me as a chief guest. I appreciate you also for the amazing questions and amazing show taking off. I appreciate everyone, the team who was behind this show. All the best and best wishes for the total team.
Thank you so much, sir. Thank you from everyone here at Medicircle. Thank you again.
Thank you. Thank you.